All right, community members are asking big questions about the Baystate Health and Mercy Medical Center merger. The deal between Baystate and Trinity Health New England is expected to close on November 1st. Until then, though, the hospitals will operate separately. Once the transaction is final, Mercy's emergency department will stay open 24/7. They're hoping to grow services and fill unused beds at Mercy, potentially adding 150 to 200 clinical jobs. But there could be harmful impacts as well.
Medical attention is paramount, particularly to the young, the elderly, and the poor. And while there's a talk about these, what I would call multi-million-dollar entities coming together and figuring out how they can work together, I haven't heard anything about what they're going to do for the community. It's important that each of these folks who are in the leadership position understand that there are large communities out there that are dependent upon them, and they need to be responsive to those communities.
Hospital leaders acknowledged ongoing staffing shortages and financial challenges, but say they're working on recruitment and helping patients stay enrolled in Medicaid.